Hong Kong's health system continues to be challenged by a rapidly aging population. 2019 population data shows that high blood pressure, diabetes, and high cholesterol, collectively termed 3 highs, have become the most prevalent chronic conditions. These healthcare demands greatly increase the financial and personnel resource strain to the health system, compromising our health system sustainability. Our Hong Kong Foundation's 2018 Health Policy Research Report proposed that Hong Kong's health system move towards a person-centred, primary care-led and integrated health system. Importantly, integrated care promotes people's timely access to a spectrum of preventive, curative, rehabilitative to palliative care across the life course and across care settings. However, the necessary system transformation is hindered as our health system resources are not strategically allocated to meet population health needs. To accelerate the development of a health system that prioritizes services based on population health needs and integrates care throughout the life course, we put forward 4 policy directions, which include 6 decisions, 5 dimensions, and 3 system levels considerations. Direction 1. Hong Kong should apply strategic purchasing to health services planning. Strategic purchasing is recognized by the World Health Organization as a critical health financing lever for improving healthcare quality and increasing financial risk protection. In this report, Strategic Purchasing Enabling Health for All, the Foundation demonstrates how strategic purchasing can be applied to make primary care for chronic disease more affordable and accessible. Direction 2. Hong Kong should introduce a chronic disease screening voucher and management scheme for the 3 highs. The Foundation's economic analysis finds that if the health system implements the scheme for diabetes screening and management for those aged 45 to 54 at scheme entry, over 30 years, the health system will save approximately 12.5 billion Hong Kong dollars on direct healthcare expenses and prevent approximately 47,000 premature mortalities. We recommend that the government apply 6 key decisions of strategic purchasing. Decision 1. Whether to provide or purchase. After taking into account the constrained capacity in the public sector, the Foundation recommends the government to purchase private sector services for chronic disease screening and management. Decision 2. Who to purchase. The government should identify a purchaser of the scheme to implement the scheme and coordinate it with other primary care efforts. Decision 3. For whom to purchase. The Foundation recommends that the scheme target individuals in the 45 to 54 age group upon scheme entry to prevent the onset and reduce worsening of chronic conditions. Decision 4. What to purchase. The Foundation recommends that the purchaser buy screening and follow-up management services in the private sector. For users without a 3 highs diagnosis, the purchaser should buy rescreening services and at least 1 follow-up consultation with family doctors. Decision 5. From whom to purchase. The Foundation recommends that the purchaser buy from private family doctors, who should serve as the first contact point for other primary care services. Decision 6. How to purchase. The Foundation recommends that the scheme employ both demand and supply side incentives. On one hand, use a voucher mechanism to fully subsidize screening. On the other hand, use provider incentives for follow-up management services. Direction 3. Health system strategic purchasing should be implemented for achieving an integrated care system to enable health for all. Beyond primary healthcare development, The Foundation recommends the government to consider the application of strategic purchasing across 3 levels: the health system level, healthcare delivery purchaser-provider system, and person journey of healthcare delivery in a coordinated manner. At the macro level, the government should strengthen governance, establish policy parameters, boost multi-stakeholder collaboration, and strengthen oversight and accountability. At the meso level, the government should define the purchasing, commissioning, and provider system, enable the integration of health services, develop systems for coordination, and monitor results. At the micro level, the government should develop an integrated, person-centered, and holistic care model using purchasing contracts, monitoring, and evaluation. Direction 4. The government must consider 5 key policy dimensions to ensure effective application of strategic purchasing. At the macro level, strengthening government stewardship and capacity. The Foundation recommends the government to name a central purchaser of the scheme and clarify its role, which includes ensuring this scheme and other purchasing programs are coordinated with each other, regularly releasing expenditure and performance reports. At the meso level, developing effective purchaser and provider organizations. The Foundation recommends the government to assess and ensure sufficient private sector capacity to meet new service demands. The purchaser should collaborate with stakeholders from the private and public sectors, such as the district health centres. At the micro level, increasing citizen empowerment. The Foundation's population-based survey findings show that 66% and 60% of respondents factor in the price of services when deciding to screen and receive follow-up care respectively. The Foundation recommends that the purchaser fully subsidise screening and involve patients in setting up co-payment for disease management. Dimensions that operate throughout system levels include incorporating population health. Strategic purchasing decisions are needs-based, so collecting and analysing population health data are critical. The Foundation recommends that the government strengthen existing electronic infrastructure, such as the electronic health record sharing system, to integrate data across sectors. Incorporating cost-effective contracting. The Foundation recommends the government to create an individualised care protocol for patients with 3 highs in the private sector. The scheme must define risk-sharing expectations between the public and private sectors and require that quality standards be met for contract renewal. As Hong Kong will face more healthcare challenges, the Foundation recommends that strategic purchasing should serve as a development framework for realising the vision of an integrated healthcare system, enabling Hong Kong to truly achieve health for all.